So, hello everyone. We have with us Dr. Lawrence Frenkel today, and we are going to talk about COVID-19 vaccination and its effect on children. Because Dr. Lawrence is a pediatrician, we are basically focusing on the kids over here. So, sir, welcome to my page, to my clinic page. So, I would like to start talking about COVID-19 vaccination. So, basically, I think the first question which comes to everyone's mind is how safe is it?
It is safe, quite safe, with the exception of rare allergic reactions, which occur about 1 in a million doses, although many individuals have a sore arm and feel less well for a day or so after the second dose.
Great, great. So, sir, is this just for the adults or are we talking about children over here?
Well, the experiences with adverse effects so far are mostly adults because the pediatric trials are just starting now. We should know about them in a couple of months.
Great, great. So, when does the immunity start building up? Like, because there's this myth, people think that once they are vaccinated, they are immune to coronavirus and they won't get the virus. So, can you tell us how and when the immunity kicks in?
Yes, it usually takes a few days to maybe a week or so. And after the first dose of the vaccine, the immunity is stronger after the second dose. It acts like an immune booster. The immunity will last, we think, months, maybe a couple of years.
Yeah, yeah. So one needs to get revaccinated after a few years, you think?
Well, we don't know that very well yet
Yeah.
because we only have about 6 to 8 months experience with the immunizations, and the feeling is that it will last a year or two, maybe longer, and that may be a moot point because of the mutational variations, we may have to get a booster periodically or even once a year.
Yeah. So basically, there's no enough evidence or research we don't have it yet, right?
That's right.
Yeah.
But the data looks good that we've seen so far. The data looks like it's going to last a couple of years and maybe longer.
That's great. Uh, so can one get infected even after getting the vaccine?
Yes, but it is unusual, and generally reinfection is asymptomatic. It's very unusual to get reinfected after immunization, but not impossible. Again, that data is also being collected now. I think everybody has to remember that this vaccine um, is only been used for like 8 months now, and most of those are in clinical trials. So we have to get more experience.
Yeah, true, true. And so, is this vaccine effective against all the strains of COVID-19, including the new variant?
Variable. Some of the vaccines seem to be more effective against the mutational variants than others. And again, we don't have enough data to be certain. We should talk again in about a year.
Definitely, definitely. So coming to my main question for you, is it safe to get the children, little kids, vaccinated with the COVID-19 vaccine? And is there any special precaution or advice in case of COVID-19 vaccination for children?
Well, again, as I said before, the pediatric trials have just started. They're maybe a couple of weeks ago. And we can guess that it's going to be safe to immunize children. And there will be no specific indications or contraindications at this time,
Okay.
except if a child has a history of anaphylaxis.
Yeah, yeah, yeah. Okay, great. So, how is the situation over there in your country? So, like, how many people are getting vaccinated? Have the children started getting vaccines yet?
Um, According to the data from yesterday, um, we have about 50,000 Americans that have been immunized, and there are really no children included in those 50,000.
Oh,
It looks like, hopefully, it will decrease the incidence of COVID disease in the United States dramatically. And the incidence has dropped. It's not dropped to zero, but it looks like it's going to be very effective in bringing the pandemic under control.
yeah, great. So,
I
like,
would, I would, I would add that when the vaccine is approved for children, it would probably be important to immunize children because there is some disease, COVID disease in children. It's not as much as in adults, but it is enough to be a significant problem.
yeah, yeah. So, your advice for all the parents would be to get their children immunized, right? Whenever the vaccine is available for them.
Yes, and I would add to that that they should get themselves immunized as well. The vaccine is the best hope for bringing this pandemic under control.
Yeah,
And I should say that it's not just the United States. There is and there are efforts to make the vaccine available to all people around the world. And that's important because if there is still COVID disease in one country, it can spread to another country.
yeah, yeah, yeah. That's absolutely true. So thank you so much, sir, for answering all our questions on COVID-19 vaccination. So vaccination is one of the main areas where Dr. Frenkel works. So that's the reason I thought of, getting some insights into COVID-19 vaccination from him. I think all this knowledge will be very helpful for all the people who view this. So yeah, and learn
Well,
from.
thank you.
Yeah.
Keep up the good work.
Thank you so much. I hope we can collaborate again with some topic because food allergies and vaccination is like a very big area of expertise. So yeah,
Well, you asked good questions.
thank you so much.
You're
Yeah,
welcome.
thank you so much. So I'll be in touch with you after this.
Very good. Have a good day, good week, good month.
Thank you so much again.
You're welcome.
Okay, bye.
Bye-bye.